We are live. We are live. I'm Dr. Frita. Welcome to Dr. Frita Live, where we discuss the latest trending medical headlines and celebrity health news. Thank you for joining us. We have quite the show for you today. We'll start off talking about the beautiful, fashionable, iconic Kiki Shepard. She was best known for being the host of Showtime at the Apollo. Well, she sadly has passed away at the age of 74 from a heart attack. We will talk about the risks of heart attacks in women so that you make sure that you and your loved ones are best informed. And then we'll talk about Ozempic. Y'all, Ozempic is under fire. Yes, the GLP-1 drug, initially for diabetes, and then, of course, in the form of Wegovy, it's being used for weight loss. Very, very popular. So many people using it around the globe. Well, now a woman developed gastroparesis after being on Ozempic for 6 months, and she passed away on her way to the hospital. Her family is now suing Ozempic for wrongful death. And so we'll break that down. We'll talk about gastroparesis. Is it linked to GLP-1s? Is it linked to Ozempic? If so, what should you do if you're taking a GLP-1 or considering one? How should the gastroparesis possible link affect you? We'll really get into that. Then we'll play my favorite little game, myth versus fact. Carrie Washington of Scandal. Who doesn't love Carrie Washington? Well, she has been so transparent. She came to the front and shared that she has been living with an eating disorder and has even experienced very intense thoughts of taking her own life. Yeah, she had an eating disorder confession. And so I want to break out some myths versus facts. I want to debunk some myths. And so we'll get into that with that game, a very knowledgeable game. And then I'll give you your second weekly dose of Health in the Headlines, where I give you a fresh take on medical information you simply can't get anywhere else. We're talking about Bethany Frankel. She is back in the headlines again, this time not for having CKD, but because she got a bloody face after a skincare routine with some glass device. And so we'll talk about what you can believe on the internet. What health or skincare devices can you trust? Can you trust influencers? What should you do to keep yourself safe? And I certainly appreciate Bethany for being so transparent, as she always seems to be. And then we'll talk about Chat GPT. Y'all know y'all use Chat GPT, but here's what I want to know. Does Chat GPT give bad medical advice? And I want y'all to be honest and tell me if you use Chat GPT for medical advice, because guess what? I have a cautionary tale. So, of course, we are live. I'm Dr. Frita. You can ask me questions, but I'm asking you questions too. So please go ahead and give us a like and a subscribe as we get started, because we're about to have a wonderful, educational, evidence-based show, because this is Monday and it's Dr. Frita Live. Welcome, welcome. We're live. I'm Dr. Frita. Welcome to Dr. Frita Live, where we'll talk about the latest trending medical headlines and celebrity health news. Let's go ahead and get started. And you know I'm not doing this alone. Let me welcome my co-host and my office manager, Miss Shador, to the front of the stage. How are you doing, Shador?
Hey, good, Dr. Frita. How are you?
Doing all right, doing all right. Life just keeps popping and life keeps lifing. And I believe that happens for everyone. But I will say that my oldest baby, my oldest child, who was at FAMU in the Marching 100, came home for a little spell over spring break. So we had ourselves a good old time bonding. And my son started his AAU basketball season as far as games are concerned. So that was a really cool and good experience. He got to play up with the 10th graders and had a good experience there. So we had some fun times and some real times. How about you?
Pretty good weekend. Went to a birthday party. One of my little cousins turned 5, so that was loads of fun. Kids weren't ready to leave the venue, but you know how that goes. We always be the last to leave the venue anyway. You shut it down. Close it on out.
And they act like they're gonna have a fit, and we tell them they absolutely have to go. Yeah, but that's a sign of good time. So good. I'll tell you a sign of not so good time, Shador. Kiki Shepard. We're going to talk about her because she passed away at the age of 74. But first, who was the first one in the chat?
First in the chat today is Miss Aileen.
Hi, Miss Aileen. How are you doing? Glad
Be
to have
to
you.
the punch, absolutely. And then we have plenty of members joining us, Dr. Frita.
What members? Who are you? Where are you? Show yourself.
Deetrix is here.
Welcome. Thank you for being a member.
Nesbit is here.
A member? Thank you.
Member, absolutely. Miss B Wellness. Hello.
Hi, Miss B Wellness. We're going to try.
Miss Andrea. Hey.
Hi, Andrea. It's one of the day ones. Thank you for being a member.
Absolutely. Miss Sheila.
Miss Sheila. Thank you.
And Peace Oasis is checking in. I always have a terrible sound.
Listen, I know you're ready. All y'all like to chime in. And so I got some questions for you. I can't wait to see if y'all get it right today in myth versus fact. So thank you for joining. So let's go ahead and get started talking about Kiki Shepard. She was 74 years old. She hosted Showtime at the Apollo along with Steve Harvey and some other hosts from 1987 to 2002. She was just a beautiful lady physically and on the inside as well. She was quite the philanthropist. She was known for her fashion and for her style and for being a diva. But what a lot of people don't know is that she was also highly educated. She graduated from Howard University and she was a member of Delta Sigma Theta Sorority Incorporated. So yes, she is my Sora. Thank you very much. Please and thank you. But yes, she passed away just this past week from a massive heart attack. And so we're going to talk about her. In the chat, I want y'all to put a red heart. And I want you to answer this for me. Tell me what you think some of the risk factors are for heart disease. Tell me what some conditions are that might put someone at risk for having heart disease. We'll talk about that, and let's play this clip in honor Kiki Shepard.
This morning, Kiki Shepard, Tyler native and the co-host of the Showtime at Apollo variety show, has died. Her representative said she died of a heart attack. She went to Emmett Scott High School in Tyler and later went to Howard University. Shepard was on the Showtime at the Apollo from 1987 through 2002, appearing with many MCs, including Steve Harvey and Mark Curry. During that time, Shepard also appeared on other shows, including Baywatch and A Different World. She also appeared in several films, including A Rage in Harlem and Blackjack Christmas. Kiki Shepard was 74 years old.
Yeah, she really had quite the career, because a lot of people know her from Showtime at the Apollo and they thought she kind of just disappeared, but really she didn't. As you can see, she was in those shows that they mentioned, A Different World. She had roles in Everybody Hates Chris, in NYPD Blue. She kept an acting career going. She did a lot of plays, including Porgy and Bess. And for people who know her well, they say that she was proudest of her nonprofit foundation, KISS, K-I-S. And it is an organization that raises awareness for sickle cell disease because apparently she had sickle cell trait. And so she was quite the multidimensional person. And again, she did pass away from heart disease. And we know that heart disease is the number one cause of death. It's the number one cause of death. And there are many things that can put people at risk. And when you're talking about women in particular, many times we have atypical symptoms, okay, not your typical chest pain. We might have stomach pain or even nausea. And it's really easy sometimes to ignore those symptoms, especially if you're that superwoman and you're taking care of everybody else, your parents, your kids, your spouse, your partner, all those things. It's easy sometimes for women to downplay their symptoms. But I want to make sure that we don't do that here. And so I want to see if anyone in the chat has participated. Come on, Medheads, let's get it going. Tell me what you think some of the risk factors are when it comes to heart disease.
Absolutely, Dr. Frita. So we have Miss Sheila.
Hi, Miss Sheila.
She says high blood pressure.
Absolutely. That's one of the largest risk factors. And I'll tell you, and y'all know, and for those who are new here, I am Dr. Frita. I'm an MD. I have been quadruple board certified. I am a board certified nephrologist, meaning I'm a kidney doctor and a high blood pressure doctor. I'm also board certified in internal medicine. I'm board certified in obesity medicine. And after I completed my MedPeds dual residency at Georgetown University School of Medicine, I also became board certified in pediatrics. I currently practice nephrology and high blood pressure. And so hypertension is something I see very frequently. And you are absolutely right. It is a leading risk factor for heart disease, for strokes. It's even the second most common cause of kidney failure. And so I want you to make sure that after this live, you go ahead and click the link in this description for everyone who's here, everyone who's coming and checking us in from the replay crew, and just grab my book, Under Pressure, A Guide to Controlling High Blood Pressure, because half of the adults in the United States have high blood pressure, and most don't have it under control. And that's why they call it a silent killer. And so you really hit it with one of the biggest risk factors, high blood pressure, a leading risk factor for heart disease. Come on to the front of the class. Come on up. Come on up.
All right. Thank you, Ms. Sheila.
Thank
Nick
you.
Mac. Hey,
Nick Mac.
Nick Mac says stress and sedentary lifestyle.
Boom and boom. You got it. You come on up to the front. Stress, absolutely. I think a lot of people downplay stress, but when you're someone who's living with stress, that actually causes the release of stress hormones like cortisol. Cortisol causes your blood vessels to tighten. And what happens if you have a blood vessel in your heart that tightens around a plaque or some atherosclerosis? You can get a heart attack. So high stress is absolutely a risk factor for heart disease. And then also sedentary lifestyle. According to the American Heart Association, most adults should be exercising for at least 150 minutes of moderate exercise. So we're talking about 30 minutes, 5 days a week. And so that has been shown to decrease your risk for heart disease. So if you're a couch potato and you have a sedentary lifestyle, then absolutely that will increase your risk for heart disease. Come on up. What else y'all got? Not bad, not bad. Risk factors for heart disease.
Theophilus, hello.
Theophilus. Y'all know I love the name Theophilus. I hope my mama's watching. She loves the name Theophilus also. Hi, Theophilus.
Theophilus says wrong diet and exercise.
Absolutely. So eating a diet that's high in ultra-processed foods will certainly increase the risk for inflammation in your body, inflammation in your heart vessels. Yeah, so definitely the wrong diet. And then if you're not exercising, again, that sedentary lifestyle. Excellent, excellent. Come on up.
All right. And a big one here, no pun intended. Queen Gina says obesity.
I know you didn't say a big one. Yes, obesity. Living with obesity is a huge risk factor. Because, if you're living with obesity, then that will also increase your risk for having high cholesterol. It definitely will increase your risk for having high blood pressure. It'll increase your risk for having a heart that's having to pump against more stress than what it is used to or prepared to having to pump against. So yeah, living with obesity. It's important to make sure you get to a healthy weight. And as I mentioned, I am board certified in obesity medicine. And we now know that obesity is it's not a blame game. Okay. It's not just like, hey, eat less and move more, like it's, the fault. And I often say that obesity seems like it's the last acceptable form of discrimination. And I know y'all see it on social media. People will go under other people's chats and they'll comment about their size if they're living with obesity, as if they care about their health, when really they're just trolling them. But anyway, if you're someone who's living with obesity and you want to really get a hold of your health journey, make sure you consult with your doctor. Don't just go online and believe gimmicks. Don't go and grab some of these GLP-1s, which we're about to talk about, unless you're under the supervision of a physician. And again, I am a board certified physician. I specialize in obesity medicine as well. And so if you want to have a conversation with me, a one-on-one, in order to start your health journey as far as losing weight, then make sure you click the link in the description, or you can always visit my one-stop shop, drfrita.com, and schedule a telehealth concierge visit, and we can go ahead and get started. Because yes, living with obesity is a huge risk factor for heart disease. Yep. Dang, no pun intended with me either. Dang. All right. Anybody else?
Yes. Member C. Jones.
Hi, C. Jones.
Diabetic.
Being a diabetic, that's huge. Yes, absolutely. You come on to the front also. Yes. And thank you for being a member. So yes, having diabetes, we know that the high blood sugar is toxic to your vessels, including your heart vessels. It can decrease proper circulation, including circulation to your heart vessels. So that makes sense. And it can just increase inflammation in your body in general. So having diabetes is a huge risk factor. So if you have it, and if your doctor is talking to you about different management, and sometimes your doctor is going to introduce the possibility of medications, before just automatically shutting off everything, sit down with your doctor, make a shared decision maker, and do shared decision making. Because what you don't want to do is say, nah, I'm just gonna get my blood sugar down on my own. And you say that 6 months is not down, a year is not down, a year and a half is not down. Let your doctor help you, okay? And sometimes that means medications, okay? We always try lifestyle first, but sometimes it means medication. It doesn't mean you're a failure. It doesn't mean you're a failure. Some people are just genetically predisposed to having diabetes. I have folks in my family in the past who have been skinny, eat just fine like everybody else, and they have diabetes, okay? So yeah, diabetes is another risk factor for heart disease. That's good.
All right. We have genetics. Carol says genetics.
You see, took the words right out of my mouth. Yes, genetics. So sometimes there's a predisposition. Certainly, with type 2 diabetics, if you have type 2 diabetes, you could probably look to the left, to the right, to your aunties, to your parents, and you probably find someone who has it. And then for patients who have what used to be called juvenile diabetes or diabetes mellitus type 1, then sometimes there are autoimmune diseases that run in the family that could predispose. So yeah, your genetics could put you at a risk, which is another, that goes to the point. It's not necessarily your fault. It's not a blame game. Either way, if you have diabetes, again, it is a risk factor for heart disease. All right, that's good. Let's keep this conversation going in the chat. And after you finish watching this live, do check out my short, because I do a nice, concise celebration of Kiki Shepard, and I talk more about risk factors. And so it's a nice bite-sized bit of information that you'll be able to share with the people you care about so that they can, help to prevent heart disease in themselves. All right. Please be sure to give us a like, a share. It lets people know that we are here. It helps the algorithm. It's a free way to support the channel. So yeah, hit that like button. Please share it to your group chat, share it to your WhatsApp, share it, or go tell them on the mountain, just share that we're here. Okay. All right. So let's talk about Ozempic, because Ozempic is under fire. Ozempic is under fire. You know this drug, the GLP-1, very popular drug. It was initially studied to treat diabetes, was found to do a great job as far as treating the diabetes, helping with blood sugars, getting the hemoglobin A1C down. And then they found in the studies that it had a side benefit of actually helping people to lose weight, a lot of weight, right? Anywhere from 15%, sometimes 20%, depending on if you're doing semaglutide or tirzepatide. At any rate, Ozempic specifically is currently under fire, and it ain't pretty. Let me tell you, there is a woman who was taking Ozempic for 6 months, and she reportedly developed gastroparesis, which we'll talk about. And after having bouts of intense vomiting, she was being driven to the hospital by her husband, but then she died on the way to the hospital of aspiration. Okay, so breathing in stomach contents, in her case, into your lungs. And now her family is suing Ozempic for wrongful death. So let's play this clip, but I do want to ask you a question. Well, we'll get into some questions. I'm curious to see what you guys are going to say. Let's watch it first.
The family of Marcia Eddinghoff is among them. They are suing Novo Nordisk, the maker of Ozempic, for wrongful death. They say Marcia had been taking Ozempic for 6 months when she got sick. Her family thought it was food poisoning, and doctors treated her for that. But after a few days, Eddinghoff complained she still wasn't feeling well. As her family was driving her to the hospital, she aspirated and died. Her death, the suit claims, was due to something called stomach paralysis, a condition where food passes through the stomach and then stays there, sitting there much, much longer than it should. Motley Rice, the law firm representing Eddinghoff's family, says studies have linked Ozempic to the condition, also known as gastroparesis. The suit claims Novo knew or should have known about the risks posed by GLP-1 medications, including severe gastrointestinal complications and other injuries. Gastrointestinal reactions and digestion issues are listed as potential side effects of Ozempic, but gastroparesis is not, according to the lawsuit. Novo.
All right. And so I want y'all to answer this question for me, and just give me a black heart in the chat. And I want you to tell me, hearing this story about this young lady who passed away with gastroparesis and her family is suing for wrongful death. Now, just to be sure, to be clear, Novo Nordisk has not been found guilty, okay? Innocent until proven guilty. But just hearing this story, give me a black heart and tell me if it changes whether or not you would ever do a GLP-1. And if you're on a GLP-1, does it change your thoughts about it? And then the other thing I want you to answer for, and you can keep the black heart just for all of these questions. I want you to tell me, why do you think it's important for people to take GLP-1s under the supervision of a doctor? Or do you think it's important? Are you someone who's doing a GLP-1 and you just are online and out there and getting it from, the corner store or from, a compounder? Do you not think it's important? But if you do think it's important, tell me why. If you don't, tell me why. Okay. So, and the black hearts we're looking for, does this make a difference on your thoughts on GLP-1s? Do you think it's important for people to take GLP-1s under the supervision of a physician? All right, so let's get into gastroparesis. What is gastroparesis? Well, gastro, stomach, paresis, paralysis. It's stomach paralysis. It's a medical condition that occurs when your stomach stops emptying food the way that it should, or it slows down the emptying. So in your digestive system, you have peristalsis, you have contractions in the stomach and in the rest of the digestive system, and these contractions help your food to move on down from the throat to the esophagus to the stomach to the intestines, from the rooter to the tutor. Well, in gastroparesis, you stop having these proper contractions and the stomach stops. And then what happens is now you have food that's just sitting there in your stomach and it's undigested. And you can have symptoms of nausea, definitely, bloating. You can vomit up undigested food. You can get abdominal pain. And yes, it's a very serious condition. And gastroparesis is most common in people with diabetes. Yes. So with or without GLP-1s, people who have diabetes are at increased risk for gastroparesis. And I know because I've taken care of many, many, many over the years, because you will recall that when it comes to dialysis, and I'm a board certified kidney doctor, the number one cause of kidney failure is diabetes. And so I see a lot of patients who have gastroparesis, patients who are not on GLP-1s. There are some other things that can put you at risk for gastroparesis. Stomach surgery, okay? If you have a stomach surgery that affects the esophagus, the stomach, even the pancreas, especially if there's like a manipulation of the nerve, the vagus nerve. So basically, certain stomach surgeries, bariatric surgeries can be a risk factor, can lead to gastroparesis. And then here's something that's not really well known. Some medical conditions can put you at risk, such as lupus, celiac disease, hypothyroidism can put you at risk. Even medications, certain medications like opioids, okay? So like you have back pain and your doctor puts you on oxycodone, Percocet. If they put you on Percocet, these opioids can increase the risk of gastroparesis, okay, of your stomach just not moving, having frozen stomach. Even certain blood pressure medications can put you at risk, like calcium channel blockers. And some of the calcium channel blockers in general are amlodipine or Norvasc, nifedipine, or Percardia. I will say I have not had a patient who's developed gastroparesis personally from being on a calcium channel blocker. And of course, I do prescribe a lot of them, but just so you know, that is a risk factor. And so with gastroparesis, now we have this lawsuit. And so the question is, oh my goodness, is Novo Nordisk at risk? Well, I certainly won't try to litigate the case, but I will go ahead and talk from a scientific perspective, the link between gastrointestinal symptoms and the GLP-1s. So I already said that gastroparesis is when the stomach is frozen. So it's not emptying the way that it should, right? It's not moving. Well, how do GLP-1s work? The very mechanism that makes GLP-1s work is that they slow down the way your stomach empties, right? They stop your stomach from emptying so quickly. And so they keep your stomach full for longer. And that's one of the ways that your appetite is decreased when you use GLP-1s. They do other things also. They stimulate your pancreas to release insulin when your blood sugar is high. GLP-1s also cut back that food noise, right? They make you less hungry. They can make you less thirsty too. So you have to be careful not to get dehydrated. But yeah, they work by slowing down the stomach. And so there's a similar mechanism for GLP-1s that's actually the intended mechanism, not for your stomach to be frozen, but to be slowed down. Well, when we look at the studies, right? So of course we had the initial studies for the GLP-1s, which allowed them to be FDA approved. But now since they've been released, we have millions more people who've used them. And so the data can change, right? So initially in the studies, like the step 1 trial for GLP-1s, they saw that there were a lot of gastrointestinal effects, like a lot of digestive issues. In fact, 44% of the patients in that trial developed nausea, and 1 out of 4 developed vomiting. And so even in the early FDA warning labels, they shared that there were possible gastrointestinal digestive issues like nausea, like vomiting, like constipation. Gastroparesis, the term was not specifically put there. But since then, we've had studies like by the JAMA. There was a 2023 study released, and it showed, because it compared people who were on GLP-1s with people who were on weight loss medications that were of a non-GLP-1 family. And they found in that study, and there were over 4,000 people, if I'm not mistaken, they found that there was definitely an increased association of gastroparesis in patients on the GLP-1s. They quoted 3.67. that people on GLP-1s were 3.61 times more likely to develop gastroparesis than the other people in the study who were not on it. And so we are seeing what looks like, if nothing else, an association. And then there's other data that suggests that the gastroparesis can occur, but it's only occurring in less than 1% of the population, in less than 1% of the people who are taking the GLP-1. So then that begs the question. We know that all medications have benefits, all medications have risks. And if indeed that number, holds true, that gastroparesis occurs in less than 1% of patients, then for the big picture, do the benefits of GLP-1s in the right patients outweigh the risks? What do y'all think? Do we have any takers on my questions before? Does this story of the young lady who passed away on her way to the hospital with gastroparesis after being on Ozempic for 6 months, does that change what you think? Do you think that folks should be under doctor's supervision? All right, Medheads, I know y'all always have an opinion. What you got?
Absolutely, Dr. Frita. I'll start with our members here. Miss Sheila.
Hi, Miss Sheila.
She feel like you should be under doctor supervision, period.
Agreed. Absolutely. And let me tell you, for a lot of reasons, but for one reason, when it comes to gastroparesis, one of the questions that I ask when I'm getting ready to give a medicine, it's really simple. If it's a diabetic, especially, have you ever had gastroparesis? They might not know what that term means. So like if they're online, right, and they click, they might say, no, never had a gastroparesis. Okay. Or if they go fill out a form from someone who's, a non-healthcare provider, they'll say, no, never had gastroparesis. But if they're coming to me, I'm saying, have you ever had extreme nausea, bloating? Have you gone days where you had a fullness of your stomach and couldn't eat? Have you vomited up undigested food? I'm describing the symptoms. And so that's going to be a nuance that a physician or a healthcare provider will be able to do, where it's like, okay, you're checking no on gastroparesis, but yes, you did have it. And I'm not going to give you the medicine if I know you've had gastroparesis, even if it's resolved. That's just too high of a risk. Okay. And then if you are someone who has, certain neurological conditions that could predispose you, I'm not giving it to you. But okay, say I give it to you and you fall into that very, low percentage of people and you develop what seems like gastroparesis. Well, as a physician, I'm going to have you following up with me frequently, and I'm going to ask those questions. Okay. I'm not going to assume that you've had food poisoning. I'm not going to assume that, okay, maybe it's just a little stomach bug, or maybe it's something you ate. I'm going to stop that medicine if I think it could even be gastroparesis, or I'm going to decrease the dose, or I'm going to spread out the frequency. There are just certain nuances. So yes, absolutely, I agree that people should be under a healthcare provider, under a doctor's supervision. Yeah. Anyone else?
Absolutely. Peace Oasis.
Hi, Peace Oasis.
I wouldn't take it for other reasons, but I don't think that would deter people from taking it. Should definitely only use it under doctor's supervision because it can cause problems than not need to notice.
Okay. Yeah, it's one of those things because again, there's more studies that need to be done. But if that less than 1% number is correct as far as the risk for gastroparesis, if I sat here and told y'all some of the risk factors for the over-the-counter medications you take, for the Tylenol, right, for the ibuprofen that you take, for the Benadryl that you take, if you saw some of those risk factors, or even if you go back and look, you'll find that a whole lot of those risk factors are higher than 1%. But even still, you might make a personal decision that the benefits outweigh the risks, right? So, case in point, if someone is living with obesity and now they're at a super high risk of having a heart attack, a stroke, kidney failure, all of those things, if we know that their risks are very high, well over 1%, over 10%, over 20%, then perhaps that person, along with their doctor, a shared decision-making process, perhaps they will decide that the benefits of taking the GLP-1, when they know that their risk of having a heart attack is 20% in the next 10 years, then the benefits of taking the GLP-1 might far outweigh their risk of the gastroparesis, which might have a risk of less than 1%, depending on the study you look at. So it depends. Yeah. So this story should certainly make people stop and really talk with their physicians and seriously weigh the risks and the benefits. Yeah.
A couple other members chimed in. Miss Allison.
Hi.
Checking in. She says, "Hello, Dr. Frita. I am on a GLP-1 Zepbound. I have Sjogren's and sleep apnea."
And you mentioned really that sleep apnea. You see that the FDA approved Zepbound specifically for obstructive sleep apnea because the studies were clear. In patients who took Zepbound versus patients who were on placebo who had obstructive sleep apnea, the ones who were on Zepbound had a clinically significant decrease in their obstructive sleep apnea symptoms. And this is why that's important. So when we're talking about obstructive sleep apnea, we're talking about, of course, the breathing being blocked. Like when you sleep, you might be sleeping, snoring, snore louder, snore intensely, and then you stop breathing. Okay, that's obstruction while you sleep. That's not breathing while you sleep. If you're someone who is living with obstructive sleep apnea that's not being treated, then that increases your risk for high blood pressure, that increased your risk for heart disease, that increases your risk for pulmonary hypertension. And of course, it increases your risk for sleepiness during the daytime somnolence, which could be a problem. It's not just a matter of napping on your desk at work. You could be at increased risk for falling asleep while you're driving on the highway, right? So having that obstructive sleep apnea in and of itself is a huge risk for mortality and morbidity. And so then, yes, if you're someone who's on Zepbound, you must weigh the risk. Is taking the Zepbound and potentially correcting or improving the obstructive sleep apnea and then releasing yourself from being at high risk for all those things I just described, are the benefits of that something that will outweigh the potentially less than 1% risk of gastroparesis? Yeah. And it does sound very much like there could be an association. Still in medicine, just like in life, it's always a matter of balancing the benefits and the risks, right? Well, I hope you do well. And I'm glad you're able to have access to that medicine because it's not cheap, I know. So I'm glad you're able to have it.
Yeah, absolutely. And then remember C. Jones.
Hi, C. Jones.
C. Jones says it's important under doctor's care. However, it's alarming to hear this happen.
It absolutely is. And my condolences to her family, Marcia Eddinghoff, because you can only imagine the whole point of her taking the medication is likely to improve her life, her length of life, her quality of life. So who wants to pass away while doing something you're trying to save your life? So it absolutely is alarming. I'm very sorry that happened to that family. Yeah. Yeah. And of course, here, I just want to make sure, because I was looking at the headlines and some things have gotten pretty salacious. I just want to come here and give a point of reference from an evidence base, right? Using scientific data and to just have a discussion to really weigh it out instead of people just getting, really, really extreme. Like, oh, all the GLP-1s are bad. Get away. They did this. Let's just wait. Let's see the story and let's look at the data that we have, right? Yeah. All right. Let's keep this conversation going in the chat. For those of you who are here in the replay crew, I see you. I thank you. Make sure you join in and weigh in on what you think. And I mentioned, exactly kind of what we do here at the Dr. Frita YouTube channel. At least I'll let you know kind of my information and my credentials and my board certifications. What I didn't mention today is that I do read medical journals every single day. And I certainly love sharing the information with you. But also, I just want to say thank you, because here on the Dr. Frita YouTube channel, we're up to over 975,000 subscribers. We are only 25,000 subscribers away. Getting to a million. So please, if you have not done so already, please go ahead and give us a subscribe, give us a like, and share us. And when you share us, ask the person to whom you're sharing to please give us a subscribe. And I'll tell you what you will get if you are here free of charge. Hundreds of videos. I have hundreds of videos on kidney disease, on high blood pressure, on cancer, on the GLP-1s, on the dangers of alcohol, on stress and why that's dangerous, on prostate cancer, lung cancer, you name it. I literally have hundreds of videos, and I share the information in a way that's easy to understand, and so that you and your loved ones will be able to watch it, pick up the information, pick up the keywords, and so when you go to your doctors, you're not overlooked. You start mentioning those keywords, asking the questions that let them know that you are interested in your health and that you are an advocate, and that helps to close that health disparity gap. Okay. These videos are meant to educate you and to empower you. So please share them. Please give us a like. Please give us a subscribe. And so I definitely appreciate y'all for that. Yay, 970K. Not too shabby. All right. So as you give us a like and a subscribe and a share, let's move on to my favorite little game. Scandal. if you watch Scandal, I want you to put in the chat who was your favorite character on Scandal and give me a little TV. I mean, was it Olivia Pope? Was it the president? Was it Melly? Was it Olivia's daddy? Ooh, he used to read the people for filth, didn't he? But put a little TV screen and put a TV screen emoji and put your favorite character, because now we're about to talk about Kerry Washington. Y'all know Kerry Washington. She was Olivia Pope of Scandal, and her career, of course, stretches way far beyond that. Well, she did a recent interview where she revealed that she's been living with an eating disorder. And not only that, she had some very real suicidal ideations, some very real thoughts of taking her own life. And so she's come out, which I really appreciate that, because, you know, she's in a place of privilege. She don't have to tell us this, right? She can keep her business to herself, but she has chosen to share it. And I know that she's going to help millions of lives. So let's play this clip, and then let's debunk some myths in the myth versus fact segment.
Referenced earlier how you have struggled with an eating disorder, and this doesn't always look the way we expect it to. Did you recognize and come to terms with the fact that you were struggling?
So I want to share with you, because I'm super proud of it. I invested in a company called Equip, which is this incredible online community for healing recovery from eating disorders. And why I believe so strongly in this work is because I've, as a person of privilege, I've been able to have group therapy and individual therapy and nutritionists and physical trainers and doctors. Like, I've had access to incredible healthcare throughout my life. And this platform, Equip, is like the democratization of that kind of healthcare. They create a team of healthcare support around every single person so that the healing, because eating disorders are such a multidimensional illness. It's psychological, it's biological, it's cultural. And so you need your team of support to reflect that kind of care. And so they do this online with people all over the country.
Incredible.
And they take insurance, and it's unbelievable. So yeah,
What a
so I'm very
concept.
proud of that work.
Wow.
And for me, I think especially it's important because a lot of people of color go undiagnosed. People who live on the margins go undiagnosed. So people who are in the queer community, women of color, men of color, I think in general, we tend to downplay how dangerous eating disorders are, even though they are fatal. So many people die every year from eating disorders. So I think for me, I recognized it because I knew that I was in a real mental health crisis. Like, the thing that actually got me to get help with my eating disorder wasn't the food itself, wasn't the behavior with the food. It was the suicidal ideation. I was like, I'm using food and exercise as a tool to not be here. Like, I'm trying to escape life, and I need to figure out how to be in life, because I was terrified.
That really shocked me when she first said that. And it goes to show that you don't always feel like what you look like, right? Because if you look at her in her career, she's a multimillionaire, very popular, very active. She's a wife, she's a mom, she's gorgeous. She's got all of the things, right? Everything on paper. She checks all of the marks. But then to now know that she's been going through this very deep mental struggle all this time, it makes me very sad. But then also, like I said, I really appreciate her, and I'm happy for her that she has found the strength to heal, to seek healing for herself and to share it, right? To really genuinely share it. So let's go ahead. Let's play myth versus fact. And so let's go ahead and look at myth versus fact statement number 1.
All righty. Eating disorders have one of the highest mortality rates of any mental illness.
Eating disorders have one of the highest mortality rates of any mental illness. Put an M1 if that's a myth. Put an F1 if that's a fact. All right, myth versus fact statement number 2, please.
The most dangerous eating disorders are the ones where the person looks extremely thin.
Okay. Put an M2 if that's a myth. Put an F2 if that's a fact. All right, pencils down. I'm really curious to see your reactions to this, midheads, because yeah, this is a very important conversation to have. And what she said was true as far as people on the margins, because growing up, at least, anytime there would be shows, after school specials, people who were on talk shows on, whether it's Oprah or Phil Donahue, the Donahue Show. For those of you who remember when those shows were hot and popping, it always tended to be women and white women. Okay, and so I like Carrie Washington's point that people on the margins, like Black women, like men, okay, like men of color, like folks in the LGBTQIA community, how it could be easy to miss, because I'm curious if y'all go ahead and count how many Black women have y'all heard come to the front and share that they have struggles with eating disorders? Not many. But I can name many of the white female celebrities who come out and shared, and some who, even if they haven't come out and shared, you look at their bodies go from being what was once living with obesity to being frankly emaciated with the gaunt faces. And you can kind of make a thought, even if we don't know, that at least they have the appearance, even if we don't know if they have an eating disorder. But it's typically white females that we see. And so I like the fact that Kerry Washington is bringing it to the front. That is not just a white people problem. It's not just a white woman problem. Okay, so this is excellent awareness. All right, so myth versus fact statement number 1. If you can read that again, let's see what your medhead said.
Eating disorders have one of the highest mortality rates of any mental illness.
What they say?
We have Miss Jacqueline says it is a fact.
Okay, how Miss Jacqueline?
Member Miss Sheila agrees it's a fact.
Okay.
Member Eloise agrees a fact.
Hi, Eloise. Thank you for being a member.
Purple Onion.
Hey there you are. What you say?
Says fact.
A fact. Okay.
Lisa says it is a myth.
Lisa says the myth. She's gonna go against the grain. Hi, Lisa.
Nick Nack also against the grain says a myth.
All right, Nick Nack.
Tisha says a fact.
A fact. All right. Can you read that another time for me, Shadora, and let's talk about it?
Mm-hmm. Eating disorders have one of the highest mortality rates of any mental illness.
This is a fact. It is a fact. And I'll tell you, and that's why I love having this discussion, because it's something that kind of goes unnoticed. We know about schizophrenia. We know about people living with major depressive disorder, and having a higher risk of being, severely down and even want to take their lives. But with anorexia nervosa, there is 5 to 10% of people with anorexia nervosa pass away. Okay, they're not here in 10 years, and if 18 to 20% are not here there is a 5 to 10% mortality in 10 years after being diagnosed, and an 18 to 20% mortality in 20 years after being diagnosed. Okay. And if you think about it, a lot of the people who have it, they're diagnosed at young ages. And so when you're looking at young women between the ages of 15 and 24, they actually are 18 times more likely to take their own lives. Okay. And so a large reason that patients with anorexia nervosa, specifically I'm talking about, a large reason that they have the high mortality is through self-harm, through taking their own lives. But there are other things beyond just self-harm. There are also some medical conditions that having such poor nutrition can put you at risk for. And so let's do myth versus fact statement number 2, and then we'll get into that.
All right, statement 2. The most dangerous eating disorders are the ones where the person looks extremely thin.
All right. What they say?
All right, so we have Yolanda says a fact.
Okay, hi Yolanda.
Miss B Wellness agrees that it is a fact.
Okay.
Miss Eloise says a myth.
Eloise.
Laura from Facebook says a fact.
Hey, welcome from Facebook. Listen, check Facebook out. I did a lot of short form content for y'all over the weekend. I did talk about Ozempic being under fire. I talked about Michelle Williams and her food poisoning after eating the nuggets for 9 hours. And that really broke down the temperatures on, what you should do. I feel like I did more also. Oh, Yeah, I did some short form content on the President Trump referring to Governor Gavin Newsom and his dyslexia, saying he's Gavin Newsom, as he calls him, admitted to having learning disabilities, dyslexia, and the president said everything about him was dumb. And so I break down dyslexia, and I have a little surprise flipping the end. So make sure you check that out. Okay, thank you for joining us from Facebook, and thank you for participating. I appreciate you.
Absolutely. So she says a fact. Eunice says a myth.
Okay.
Member Miss Sheila says a myth.
So we got it's a good mixed bag. Wonderful.
Mhm.
Okay.
Member Miss Deidre, hey.
Hey there. Thank you for being a member.
She says it is a fact.
Okay.
And member Andrea says a myth.
A myth. All right. Read that for me again, please, Shadora.
The most dangerous eating disorders are the ones where the person looks extremely thin.
This is a myth. This is a myth. And okay, so when you see someone who's extremely thin and emaciated, then chances are it's true that they're not healthy. Okay. But that does not automatically assume that they're the person with the eating disorder at the highest risk. Let me tell you who's at high risk. People who are doing binging, purging, vomiting, and getting electrolyte abnormalities. Oftentimes with these electrolyte abnormalities, you can have heart arrhythmias and die of sudden death. And so I'm talking about people who have eating disorders, like even if you're someone with bulimia nervosa, you are likely going to have a normal weight or near normal weight, but you could be at a higher risk because of the electrolyte abnormalities from the binging and purging, and you could be more likely to have a cardiomyopathy or an arrhythmia and pass away than someone who is extremely emaciated, but who's not having those same fluctuations in electrolytes, right? And then also when you have people who have poor nutrition, even if they don't necessarily look as emaciated, depending on what's going on with their blood sugar levels, with their protein levels, they can get damage to their brain from having the poor nutrition, damage to the heart again, heart failure, cardiomyopathy, damage to the liver, kidney failure, and they might not necessarily look emaciated. So my point is, if you have someone who has an eating disorder, even if they look like to you, no, they look okay. They're a zero, they're a double zero, they're not, 60 pounds or the weight of a child. It doesn't mean that they're not unhealthy. And if you have someone who is quote unquote of normal weight, or they have a kind of a mainstream BMI, but they're having an eating disorder like binging and purging, that person could go out, okay, from a cardiomyopathy, from an arrhythmia, even before the person who's emaciated. So you don't just judge a book by its cover. If it's an eating disorder, it's not just what's happening on the outside or how they look. It's an internal thing, okay? So being emaciated is not automatically the marker of someone who's more at risk. Okay, so that's really an important point. And then, so I got into the electrolytes a little bit, but yeah, some other things to recognize that are going on the inside, in addition to the organ damage that I mentioned, dental caries. Okay, specifically for people who are vomiting and that stomach acid is rubbing against their teeth. A lot of times patients like with bulimia will have dental caries. So really just the main thing is to have no shame. If you're someone who feels like you're having struggles with weight, with eating disorder, reach out to your doctor, reach out to your healthcare provider. And let's put a link for Carrie Washington's organization that she mentioned, where there's a team. So we'll have a link in the bio to Carrie Washington's organization for you. But just make sure that you seek help. And if you see it in a loved one, please figure out a way to approach that person, because as we mentioned with the eating disorders, it's not just a matter of physically having symptoms and issues to the point where you lose your life. Many of them have co-disorders like anxiety, like depression, like obsessive compulsive disease. And many of them have thoughts of taking their own lives, and they actually do take their own lives. Okay. And then specifically talking about anorexia, they have a much higher chance of taking their own lives than women who don't have it in the same age range. We're talking about teens and young women. And right here, we have Carrie Washington herself saying that what really prompted her to get help was the thoughts of suicide. All right. So thank y'all for participating, and and I thank Kerry Washington for making us aware. And I really pray for the best for her. I really appreciate her. All right. Please go ahead and give us a like. If you haven't done so already, hit that like button if you're just joining us. And if you're in the replay crew, you know what to do. And let's go on to your second weekly dose of medical headlines where I give you a fresh take you simply can't get anywhere else. Y'all, Bethany Frankel of Real Housewives of New York, the original, she's the OG. And then, of course, became a business mogul, had Skinny Girl, among many, many, many other businesses, a philanthropist. She did a lot of work in Puerto Rico during the time when they were having natural disasters. And she stays in and out of controversy, but I'm not going to lie. I really enjoy the transparency of Bethany. And she did it again. She was transparent when it came to something online that she was using for her face, some dermatologic glass facial contouring cupping. Let me let her tell you. Let's play the clip.
Oh my God. Oh my God. I bought this product, Nurse Jamie, that someone on here was promoting, these balls that are supposed to contour your face. And I thought, oh, I grind my teeth and my jaw is pronounced like it hurts, so it would give some relief. And I thought I saw red in there, and I thought it was my skin, and they're glass. And I was slicing. Do I put Neosporin? What exactly do I do to get this to close up right now? Please don't believe every person who promotes something. This is super scary. I was going to go down my neck, and I could have sliced my jugular. I'm freaking out. I have this stuff coincidentally called skin repair.
I know she's not the only one. Who has seen, someone on television, one of these celebrities or influencers, or just someone who, even if they're not a doctor, they sure seem like they have a lot of authority, or perhaps they have perfect skin and they're nicely sculpted and they're swearing that they got their way from their product. And I want you to put in the chat, and I want you to give me some dollar signs, give me some cash, give me some money as an emoji. And you can give me some cash for real if you want to, but give me a cash emoji. And I want you to answer this question. What is the wildest claim you've ever seen from a product that was on social media? Someone made a claim and you're like, now that's wild. What's the wildest claim you've ever seen of a product? And I'll tell you mine too after we finish talking. But yeah, it's just important. As Bethany pointed out, don't believe everything that you see. Don't believe the hype, because you have a lot of these celebrities who are going and they're telling you to purchase something, but you got to remember, many of them are bartering, where they're getting free service, whatever that service may be. And the other thing you got to remember is that many of them are actors. Hello, they're actors, and so they can really sell you on something even if they don't believe it. And so I know you love your celebrities, you feel like they're your family members, but you really don't know them. You really don't know them to know their hearts and if they're really trustworthy, and you don't know their pocketbooks to know, if someone gave them an offer they can't refuse. Same thing with influencers. They're getting paid, and so they're not necessarily always telling you the truth. Are there people who give you products and they really do happen to work out? Sure. But when it comes to health products, like something for dermatology, please consult with your board certified dermatologist, or at least start with your internal medicine doctor, your family medicine doctor. Many of us are trained. We are as primary care doctors when we go through internal medicine or, whatever primary care track, to know quite a bit about dermatology. Okay. And we still have to get board certified in our field, even though it's more general, but we can certainly help you with a lot of the general issues, or at least point you to know when it's time to see your board certified dermatologist. And I'm looking at Bethany, and I definitely can understand, her getting caught up in ordering something, but y'all know good and well, Bethany is a multi-millionaire. So she has access to board certified dermatologists, but it just goes to show anyone can get caught up in the hype where something looks like it's harmless. So just be careful, go to your board certified physicians, and don't get caught up on the different shops, TikTok shops, or the advertisements when it comes to health products. Okay. Skincare products, devices, certainly medicines, things you're putting in your mouth. So let me hear what y'all say, and I'll tell you the wildest thing I've seen. Ooh.
Tisha.
Hi, Tisha.
Tisha says, I saw a commercial with a body shaper was supposed to make your waist go down almost 2 sizes. How can you breathe, ma'am?
I know that's right. And I wonder if they were talking about it was gonna cause your waist to go down for good, or if it was just gonna go down 2 sizes while you had it on. Because you're right, they probably could squeeze you in to a point where you can just about pass out the way they used to do in olden times, and they tie those corsets really tight. They probably could squeeze you in, but what are they doing to your organs? And you're right, where your lungs got to go somewhere. Your lungs are probably being pushed up inside of your rib cage. So yeah, that's wild. And you definitely want to use your common sense on, is that a healthy thing to do, just to have a snatched waist for a night? Good. What else?
I remember Miss Deidre.
Hi, Miss Deidre.
I saw something where you would lose weight in 7 days.
Lose weight in 7 days. That's wild. Now, is it possible? Sure, it's possible to be absolutely starved down, drinking water where they pretend they have the proper nutrients in the water, but it's starvation. And we know if it's not a lifestyle adjustment, just a crash diet is not going to do. And the weight that you're losing, is it real weight, or are you being dehydrated for 7 days and now you're putting yourself at risk for kidney failure? That's wild. Don't believe the hype. Good.
Yes.
Oh, I like these. What else we got?
Sandra, hello.
Hi, Sandra.
Sandra, a product says improve collagen production by 1,200%.
Okay. So first of all, when you see things like that, that's a good point. 1,200%, that's pretty specific, isn't it? I would, if you're good at doing research, I would kind of go and look, or even call them and write them and ask, can you provide the study that gave you the 1,200%? How did you get to that number? Okay. Because that's a very specific claim. It sounds pretty scientific. Could it be true? I don't know. But it's wild, which is my point. What's wild? You want to find out what study. And because if you're not yourself a board certified dermatologist, I would take that product and I would go to your dermatologist or to your doctor and send the information, send the study, and actually make an appointment and go in with someone who's in the medical field to find out, can this product really improve the collagen? You know, I would find that out, because that's quite the wild claim. And if that's a fact, then why isn't everybody around here looking like Benjamin Button and looking extra young instead of looking so tired all the time?
Speaking of, Miss Sheila says reverse aging.
Reverse aging, that's my favorite. Reverse aging. So it's really interesting, especially when you see celebrities. Now, clearly, are there certain skincare regimens and micro needling and healthy eating and different things in a day? Is it possible that they can help you to slow down the aging process, or to not really slow down the aging process, but to look more youthful than you would have? I'm not doubting that there are some things that could be helpful, but when you have all of these wellness and longevity specialists who are not physicians, then a lot of times they're just taking your money. If I'm honest with you, a lot of times they're just taking your money because one fact is that for the celebrities who are getting up and showing you, oh, I use this product and look, I look young. A lot of them have had surgical procedures. Okay. You got people in Hollywood getting Botox starting in their teens and certainly in their 20s, getting facelifts in their 30s. Okay. And these same people might get up here and be influencers and tell you how young and youthful they are and what products they use, when quite frankly, in some cases, the product they use might be the knife of a very good plastic surgeon. I'm not knocking it, but a lot of times there's a lack of transparency. So be careful when you look at your favorite influencer with perfect skin and perfect lips and perfect cheeks and all of that. They might be under the knife, okay, and not telling you.
All right, and we have Alanet.
Hi, Alanet.
I'm sorry. Altonet says hair growth products such as oils that's supposed to make the hair grow, even alopecia. That's ridiculous.
How much money do women spend on that? Now, listen, you come to the front of the class because that's the real one. Every other day, you got a celebrity, a star, or just someone who has thick, long hair, quite frankly, from their genetics, telling you how you can grow your hair out. When honestly, all of us are born with hair. It has a memory of how long it's going to get before it falls out. Now, you can certainly take care of your hair and keep yourself from having dry hair, from having split ends, things of that nature, to keep it from falling out faster. But a person who gets up here whose hair grows to her hips, and that really is her genetics, please don't allow her to sell you a product and tell you that you too can grow your hair that way. Because I'm sorry, I want you to hold my hand when I tell you this. If that's not how your hair is meant to grow, it's not going to grow thick all the way down to your hips. If y'all look, Shador, where are you, Shador? Shador hardly ever wears her hair out, but when she does wear it out and pressed, it goes practically to the floor. So it does go down to her hips. And Shador can tell me, I don't care how many oils or products she and her twin sister are using, unless you got their genetics, your hair is not going to go to your hips. Now, maybe you can maximize your hair growth, but that's why people tell you can get your hair to grow like theirs just by a product. The other thing is, you're right, with the alopecia. A lot of women have traction alopecia, right? Like from having cornrows that are too tight, or weave styles where the braids are pulling hair out the follicles over months, weeks, years, to the point where they go clean. Okay. They have traction alopecia. And in a lot of cases, there's not much you can do other than a hair transplant. Now, there are some different forms of alopecia, like if it's from an autoimmune cause, from psoriasis, and there are treatments, but I'm sorry to tell you, it's not typically going to be the oils that you see on the internet. It's going to be you going to your doctor, to your dermatologist, and your doctor might offer you some general treatments to treat the underlying issue. For example, if lupus is causing you to have thin hair, they might treat the lupus. If psoriasis is doing it, they might give you an infusion to treat the psoriasis. And they might also do injections of the scalp, steroid injections. They might even put you on minoxidil, like a topical minoxidil, like a Rogaine, or even an oral minoxidil. So there are treatments for the alopecia, but if someone is getting on and they're telling you that for $5.99 you can buy their oil and your alopecia will go away, that's wild. So y'all have given some very good examples, and I'm sure that people are listening are thinking, oh, dang, I bought that product. Because I'm telling you, like, when you look at these hair products, it's so hopeful. And again, I'm not saying that there aren't hair products that can help your hair to grow to its maximum. But as far as these miracles, if it looks too good to be true, your mama already told you it's probably not true.
What about this one, Frita? This is from
another
Sherry.
one.
Yeah. Ooh. Sherry says the crazy 3-ingredient Jello diet that all the celebrities are supposed to have lost 40 to 50 pounds in a month from Dr. Oz.
Did you say Dr. Oz? All right. Let me just say this. If it's something wild, I'm not saying that you can't, go on a crash and lose a lot of weight. But if what is being sold to you is something that is not sustainable, like if you know that if you're on a cabbage diet and you know you're not going to eat only cabbage for the rest of your life, if you're on a Jello diet and you know you're not going to eat only Jello for the rest of your life, then it is my recommendation that you find a diet that is more well-rounded, that will be less of a diet. Because what are the 3 words in diet? The first 3 letters in diet? That's how you feel, like you're going DIE if you're doing something that's just not even close to being natural. So you want to do something like a Mediterranean diet, for example, where you have the different leafy green vegetables, the olives, the fish, where there's some type of a variety. If you're on a diet that's totally restricting you, where you can't have any fruit at all, that's not sustainable. And I'm not saying that, you can't listen to your dietitian and your doctor and jumpstart your weight loss in certain ways. When it comes to something sustainable, doing Jello or doing whatever 7-day crash, that's not going to give you that long-term healthy weight loss that you want. So if someone's telling you, hey, let's lose 40 pounds with Jello in a month, that's wild. That might get you into that wedding dress or whatever you're trying to go into. But we want to think about long-term longevity, and that's not the way to go, right? Not for the long term. All right. Let me tell you what the wildest claim is to me. And I see it in different forms and I see it in different ways. When folks get on this screen, they're not doctors. They're certainly not kidney doctors. They're not nephrologists, but they somehow have the magic cure for kidney disease. Kidney detox. Drink this and it'll cure your kidneys. Kidney detox. Take this pill and it's guaranteed to reverse your kidneys. Not true. And I have so many patients who come to me and they say, I got this kidney cleanse. They say it's going to revert. No, it's not. I'm sorry, it's not. Now, there are certain things that can help your kidneys to filter better, okay? Certain fruits, certain vegetables, certain things that you can do with lifestyle, water drinking, decreasing your blood sugar, maintaining a healthy blood sugar, there are lifestyle adjustments. There are juices and drinks that have, fruits and vegetables that can help your kidneys to filter better, but there's no one-stop shop magic treatment, kidney cure, kidney cleanse. And please, after you finish watching this live, check out my video here on my YouTube channel, The Truth About Kidney Detox, okay, where I break it down. Because when I see people promising kidney cures, that's wild. And also, I have the best drinks and smoothies and juices to help your kidneys. And then I also have videos just on food, 15 foods to help your kidneys to filter better, like anti-inflammatory foods. It's not a one-stop it's not a boom magic bullet, but it's multifactorial the way that you got kidney disease. And so it's going to be multifactorial the way that you get it to improve or at least slow down its progression. But please don't believe these people who say, drink this and cure your No, they're making it up. And that's wild to me. All right. Let me ask y'all one more question here. And I want y'all to, you know what? Just give me a nice good old fashioned smiley face emoji. And I want to know this as y'all give us a like and we move on to the next thing. I want you, hey, Claudia, hey, Funky Daniva. I want you to tell me how many of you use ChatGPT as one of your primary sources for health information. Now, I'm not just asking if you use it as a supplement and you go to your doctors and you look up reputable sources, but how many of you use ChatGPT as your primary health source of information? Can ChatGPT be your doctor? Let's play this next clip and then I'm gonna see what y'all said.
Okay, a new chatbot designed to answer your medical questions may not be as accurate as you think, especially in high-stakes situations. NBC 10's artificial intelligence reporter Brianna Borghi has a closer look at ChatGPT Health and what doctors are saying about the new tool. Brianna?
Well, Amelia, a quarter of ChatGPT users ask about their health every week, but a new study shows that a chatbot may not always be accurate and may not even take your symptoms as seriously as it should. As more and more Americans turn to artificial intelligence for medical advice, OpenAI is now testing a new health-focused chatbot called ChatGPT Health.
I'm cautiously optimistic. I am very excited about the philosophy that healthcare is different and that it needs a unique and separate tool to deal with healthcare and healthcare questions.
According to OpenAI, 5% of all ChatGPT messages are about healthcare, and 40 million users turn to the chatbot every day for health-related questions. ChatGPT Health is a separate program, and after putting it to the test, researchers found that more than half of the time, the chatbot said it was okay to delay care when a real doctor would have sent the patient to the ER.
See, and there you have it. And there you have it. And there's one study showing that ChatGPT gets it wrong 33% of the time. So it's okay to look and be curious, but please understand ChatGPT is not a doctor and it can be life-threatening. Let me give you a specific example. There was one person, the two people who had headaches. And as it turns out, their headaches were from the same very serious, potentially life-threatening cause. One person answered in ChatGPT and said, "It's the worst headache of my life." And that person was appropriately sent to the ER by ChatGPT. The other person didn't use that language as they did their different descriptors from the headache. And they were told that it was okay to stay home and take aspirin. When someone has the worst headache of their life, the one thing you really want to work out is, are they having a brain bleed? Okay, like a subarachnoid hemorrhage, right? Life-threatening, potentially fatal. And if that person who was also having the worst headache of their life, but didn't put it that way, if indeed they were having a brain bleed or a subarachnoid hemorrhage and took an aspirin, that would hasten their fate, right? And so that's just one example. ChatGPT is not the same as someone who has been going to medical school and practicing for decades. I'm telling you, because even people just look at me in all the years, all my good young years I spent studying, so in order to become a doctor, of course you go through high school, you go through your 4 years of college, you go through your 4 years of medical school, and then you choose your specialty. You go to a residency where you have your first year and intern year, where that's kind of your first time being let loose on the patients. And I went to Meharry Medical College and HBCU. Thank you very much. Love Meharry. And so you spend your first year kind of really learning how to stand on your own 2 feet, being a doctor. And you make mistakes, which is why you have your supervising doctors. And so you do your residency, be it 3 years, be it 4 years. Mine was 4 years because I did a dual residency at Georgetown. I did internal medicine and pediatrics. I did both of them. And boy, did I learn a lot going through that, on how to care for patients, bedside manner, medications, how to run codes when someone has cardiac arrest, how to deal with children and children's health while also dealing with the emotions of their parents. dealing with domestic violence, all the things. You learn that. Okay. And there are nuances and certain emotional IQ cues that just can't be replicated. And then if you choose to go on to do a specialty like I did the nephrology, the kidney specialty. I came down here to Emory to do that. That's another few years, depending on what track, whether it's the research track. And then after that, if you want to do more things like obesity medicine, yes, you don't have to have an obesity medicine license in order to prescribe GLP-1s, but I chose to go ahead and get that extra education so that I can be board certified in obesity medicine. You see my point? There's a certain just a time and energy and education and an experience in a human doctor. Okay. And then if you take the type of person who is so obsessed that they actually love medicine so much so that they love to read about it every single day, all day, then there's not a whole lot that can replace that. Okay. Plus the human touch, people who've gone through experiences, who are your doctors, but who are also patients themselves and who can understand it, who might also be a woman like you or look like you or have some type of a common experience. All of that goes into being able to be the best doctor for you. And while ChatGPT has its place, it does not replace a doctor. So now y'all come on and tell the truth. Who said they use ChatGPT as their doctor? I'm gonna get you. Come on. Don't be shy. Come on. Anyone?
Yeah, Dr. Frita. Sorry about that. Quite a few people do.
Ooh.
So Sherry, well, they actually don't use it. Some they don't. But Sherry says people are looking for easy and quick information these days. It's very dangerous.
It is. And I'll tell you, again, like I said before, it's okay to use different things as a supplement, but you have to understand we're not replacing the real thing. And one thing I want to mention, and I appreciate all of you. I want to give a special appreciation to my members, because in order for you to sign up and be a member, I know that you can take your resources and put them wherever you want. But the fact that you put them here and then you support our channel, I appreciate you. And so I encourage all of you to be members, because when we talk about getting medical information, now what I share with you here does not replace what your doctor says. Okay. I'm giving you just more medical information. Okay. I always tell you that. Talk to your own personal medical doctor. But what we do here is we do share a lot of medical information, as you see, but we also have our membership where if you're a member, then you get special videos, okay, members only videos. And you'll see at all tiers, I have the certain videos like my Healthy Habits Quick Tips. I'm gonna give y'all another one today, a Healthy Habits Quick Tip. What is this one going to be? Ooze. Okay, I know what it's going to be. Y'all just check it out. And then if you are at the resident level of membership, you have the membership grand rounds. And I want to do one. Y'all stay on the lookout with your emails and also on the notifications that you get here, because I'm going to do a grand rounds this week, because I just learned that the owner of OnlyFans passed away at the age of 43. It might have just been today that he passed away. And reportedly, he passed away with cancer. And so once I get more information about that, we'll do a grand rounds where I'm actually going to go live with you for all of my members who are at the resident tier and at the chief residence tier. I'm going to go live and we're going to talk about cancer once we find out specifically what he was living with. And then we'll also go ahead and touch base and do some other talk about cancer, some other updates. So stay tuned for that, and I'll let you know exactly when we'll go live. It was just us, members only. And then for those of you who are at the top tier, the chief residents, every month we do a live Q&A. And so there are lots of benefits to membership. And again, I don't replace your doctor, but I certainly do give you some human knowledge, evidence-based knowledge that you can take and you can add to your own health care. But please just don't be talking to a bot and let your life depend on it. My goodness. All right. So do we have any other comments or questions on our way out the door, Shado?
Yes. Aishan says, I've used AI about 5 times now over 3 years, but each time AI said to go see a real doctor. So AI helped me to go see a doctor, which otherwise I'm reluctant.
Well, that is good. That is good in your case. We see, however, in the study, it didn't always go so well. So I'm glad that worked out for you. And I hope now you take that information, and even if you ask AI a question, I hope you'll be asking it while you're already on your way to see a doctor. So good.
All right. I have a question from member Miss Elaine.
Hi, Miss Elaine.
She says, Dr. Frita, are you familiar with Helifo, iconic foot spa to remove toxins and heavy metals?
So I'm not familiar with that particular name. I am familiar with various med spas and various wellness people who say that they're removing toxins and heavy metals. I can give you one specific example of a patient I had, a dialysis patient. Shador, you might remember her. She always had her husband with her, be fussing at him, love her to death. But she was going to a spa and they were, putting different things on her feet. And they were like, oh gosh, your feet, oh, they turned black underneath. That lets me know you have a lot of toxins. And they had all these ideas about how they were going to remove her kidney toxins. And she believed them. And so she stopped her dialysis because they told her that they would be able to get all those kidney toxins by going through her feet. And clearly that didn't happen. And she ended up in the ICU. Okay. And you can just kind of guess how a story like that might go. So I am familiar with more than one different wellness person. One of them I know even was in a van, one of those mobile homes, like one of those, what do you call them? Those vans that you do your trips with and you go camping. He would carry one of those around and get toxins out of your feet. I had patients tell me. My advice is go to your board certified physician, okay, about removing of any toxins, because what they're telling you is likely going to cost a lot of money and there's not going to be evidence-based medicine behind it. Ask them what studies they have, but make sure you talk to your board certified doctor. I don't recommend it. Anyone else? Oh, and that's a member. You can come. We can have a live Q&A, and if you're comfortable, you can bring information about it, and we'll sit there and we'll break down the evidence or lack thereov right then and there. Yeah, bring that to the Q&A.
All right, thank you, Dr. Frita. Shout out to Ms. Rosalind. We did shout her out, Miss Member, our member.
Oh, Ms. Rosalind, thank you.
She's joining us today. And this, I think we get this question a lot, Dr. Frita, from our kidney patients. This is from Miss Sheila.
Hi, Miss Sheila.
What multivitamin should I use with CKD?
Well, definitely I want you to consult with your doctor, because your doctor is going to know exactly your level of magnesium, your level of sodium, your level of your chloride. They're going to be able to know your vitamin D levels, okay, your vitamin B1, your vitamin B6. And so they'll be able to tell you the best multivitamin. But I'll tell you in general, for my patients, depending on their level, if they've progressed to more advanced kidney disease like CKD stage 4, CKD stage 5, I will often put them on a specific vitamin that repletes a lot of B vitamins. I'll put them on something like a Nephrovite, a Renovite, or quite honestly, a lot of my patients, I will give them prenatal vitamins. My men also, and that's usually a time. I'd be like, no, sir, I don't think you're pregnant, but this prenatal vitamin has a lot. Consult with your doctor, but just in general, the prenatal vitamins actually have a lot of good sources. But yeah, you'll need to consult with your doctor. But as far as what I use, prenatal vitamins, and then certainly for my patients who are on dialysis, Dialovite, Renovite. But even I find that some of the nature-made multivitamins, Centrum, I need to stop because I don't want to be a commercial, but I'm just being honest and telling you some of the vitamins that tend to work well in my patients. But again, I check my patients' numbers, so I know what their magnesium, their potassium, their calcium, I know what their numbers are, which is why, again, I say consult with your doctor to find out the best multivitamin for you.
All right. And then from our member, Nesbit. Hello.
Hi, Nesbit. Thank you for being a member.
Nesbit says, do we all have parasites?
No. And I know why you're asking, Nesbit, because I see this is another wild thing. People who have these parasite cleanses or have they go through these riches and these regimens on how they detox themselves from parasites. But when you think about parasites, and I'm talking about like lethal parasites, toxic parasites, like a tapeworm or something like that. One is going to very likely give you symptoms, okay, like weight loss, severe nausea, severe vomiting. But as far as just your body, your day-to-day life as a healthy person, you don't have to be worried. And let me know if this is not where you're going with it. You don't have to be worried about doing parasite detoxes or parasite cleanses, things of that nature. We don't have large randomized controlled trials or any evidence to support that people who do parasite cleanses are any healthier than people who don't. Because here's the truth of the matter. if you actually do have a parasite, something like some of those brain-eating parasites, if you have some type of an amoeba, or if you have a tapeworm, if you have something like that, then it's going to take a medication, an anti-parasite medication to get rid of it, not a cleanse or something to detox. And when I say that, it's really interesting because I actually have a lot of, like, I have people I know very well, very highly intelligent people, and they'll do the different things, like the kidney cleanse and the detox. And so by no means, if you're someone who's doing those things, please don't misunderstand me. I'm not saying that you're not smart to do it. What I'm saying is there is some marketing out of this world that people will do to get you to believe that these things will make you healthy. But I'm telling you, there's no randomized controlled trial, no evidence-based medicine that these things are going to help you. Okay. So if you're someone, especially if you're spending a lot of money doing it, or if you are doing the parasite cleanse and you haven't talked to your doctor, I recommend that you not take the parasite cleanse to your doctor and see what your board certified doctor says. All right. Anything else? I like these questions. Can we take one more before we go out the door?
Sure. We can take one more question.
Okay, one for the road. Make sure y'all go ahead. Please give us a like. Make sure y'all click the link in the subscription. Make sure that y'all get my book, Under Pressure, Guide to Controlling High Blood Pressure, for y'all to continue these questions with me one-on-one. Make sure that you get a telehealth concierge service to start your weight loss journey. Get a telehealth concierge visit with me. And also in this link, click my freebie. I have a freebie for you. 10 healthy habits for a better you and a better life. Click that to find out some of the habits I use for my daily life. And check us out tomorrow because I'm releasing a new video. You'll see what it is tomorrow. Members, you'll probably see it early. That's another perk of being a member. You get first look at a lot of my videos.
All right. Thank you, Dr. Frita. This last question comes from Nick Nack.
Hey, Nick Nack.
Nick Nack says, Dr. Frita, do you have any opinion on bariatric patients using GLP-1?
So do. Although I will tell you, so I have, I see a lot of bariatric patients because, as you can guess, a lot of patients who had been living with obesity, many of them had diabetes, which diabetes, again, is the number one risk factor for kidney disease. So I'll see a lot of them in my kidney clinic. And for the ones who are able to successfully have the bariatric surgery and continue with the exercise that's recommended, and the ones who continue with the nutritionist and the caloric restriction, those I haven't seen, they tend to not need the GLP-1s. But for some of the other ones, their obesity situation might be more complex. It might be a matter of kind of eating through the gastric sleeve or through the gastric bypass, where some of them, they just still have that food noise, right? Where they're still eating to the point sometimes where they even vomit. And a lot of times they'll be placed on GLP-1s to get rid of that food noise, where they're not trying to overeat the bariatric procedure. And so I never, ever, ever have a patient on who's had bariatric surgery and on a GLP-1 without consulting with the surgeon. Okay. And so if you're someone who's had bariatric surgery and now you're going online to get a GLP-1, I don't recommend it. Please go back to your bariatric surgeon and talk things through there and find out if they agree with you being on a GLP-1. So yeah, so even for my patients who are on it, is not without the consent of the bariatric surgeon. Okay. Because one of the things, after you finish this, check out the short that I did. And it's on different social media platforms right now. I did a short where I talk about gastroparesis and GLP-1s. One of the risk factors for gastroparesis is if you've had a bariatric surgery. Not everybody, but it is a risk. And if somehow the vagus nerve has been manipulated, when the esophagus has been operated on, or the stomach. And so what you don't want is to be on a GLP-1 if you're someone who happens to have a high risk for gastroparesis because of the bariatric surgery. Take home point, please don't do it without talking to the bariatric surgeon first. Okay. Thank you. I like that question. All right. Well, I certainly thank y'all for all of your participation. I always love my med heads. Y'all are smart as fire. I'm not even kidding. I love it when you participate, when you ask questions, when you answer questions, because I'm telling you, you are helping each other. You're helping this entire community, everyone who comes here on Dr. Frita Live. And so again, please make sure you give us a like if you haven't, give us a subscribe, share Please share. I guarantee you that you have loved ones who will be able to benefit from the videos. I put my heart and soul into these videos. And most importantly, I give you evidence-based information so you'll be able to effectively advocate for yourself and for your health and for the health of your family. So please share the word and come on, give us a try. Join our membership. It's not very expensive. You spend more at Starbucks than you'll spend on our membership, and you get even more evidence-based information. I give you a different little side of my life also, child. The members who know, y'all know. Listen, I posted another members only video while I was sitting outside of my son's AAU game. Oh, it was actually kind of serious, child. Anyway, it's a whole different side on the membership. It's different than what you get here. So please go ahead, click the link in the description, or go to my one-stop shop to join the membership. Anyway, as always, I appreciate y'all for being here with us for Dr. Frita Live. I appreciate my co-host Shador, and I want to say thank you to all of you for making Monday your healthiest day of the week.